We want to keep the momentum going as we draw closer to the end of our day one of this workshop on Let's Talk About Marketing. And next we'll have our lightning round discussion, which I'm sure will be pure fire. And we want to welcome Dr. Neha Jain from HRIDAY to the microphone. Over to you.
Thank you, Kimberly. Hello, everyone. My name is Dr. Neha Jain. I'm a research fellow with the Public Health Foundation of India, and I am also working with HRIDAY for this very specific workshop. I'm also a part of organizing the organizing team that has put together this workshop. We've had some very interesting presentations this morning, and we've seen how alarming. We've seen some very alarming examples of how the tobacco industry or the alcohol industry has been marketing and targeting specifically youth. But in this particular lightning round session, we'd like to focus on how we've been fighting back. And when I say we, I mean all the youths that have been fighting back and all the various organizations that have been fighting back on all these marketing campaigns done by the tobacco and alcohol industry. And specifically, I'd like to focus on how youth have been crucial in taking this momentum, to keep the momentum going on this fight against wrongful marketing by the tobacco alcohol industry, specifically to children. It has been very well documented that the increased involvement of youth in various initiatives and movements across the globe has sort of been responsible for promoting a variety of social changes. With the youth-led initiatives have led to they have led to debates of national importance. They've led to important health science research, and they've also led to increased access to post-secondary education. Youth have remarkably been present to further the cause of climate change and environment protection, health and well-being, or tobacco and alcohol control. So, well, in this session, we'll basically focus on such examples of advocacy. We'll talk about how advocacy looks different, how it has been done in different parts of the world. We have some examples from India as well as some other countries as well. And we will also talk about how it has been instrumental in bringing a change, especially if this hinges on active involvement by the youth. I will not take a lot of time because we are running a little bit late, but I would like to introduce our first speaker, Ms. Tina Rawal. Tina is a very dear colleague, and she's the Director of Youth Engagement and Partnerships at HRIDAY. She's also the Research Scientist at Health Promotion Division, Public Health Foundation of India. Ms. Rawal is also working as the Director of Youth Engagement and Partnerships, and she works in the field of nutrition and public health, and has been doing so for the last 15 years. So over to you, Tina, and I look forward to your presentation.
Thank you, Neha, and good morning to all of you. I think so it's like a good night for us, but I think good to be a part of this workshop, and thanks to Daniel and all the group members who have organized this workshop. I'll just share my screen. I hope this is like the slides are visible. So just to give an overview of the study which we have conducted like in India, and just we have been hearing like since the beginning of the workshop, and studies have also shown that tobacco advertising through media creates positive product imagery and association in the minds of young people. And research from India has shown that media advertising and exposure to tobacco brand names or visuals of actors smoking on screen are associated with increased smoking among youth. Consistent with the Article 13, which we have heard about this article in the previous talk as well, as a part of the WHO Framework Convention on Tobacco Control, and the Section 5 of India's Cigarette and Other Tobacco Products Act prohibits advertising and promotion of tobacco products in any media. In this study, why films and TV rules in India? Because India is the world's largest producer of movies in different languages. Bollywood represents the Hindi movie industry, and about about 25% of total movies every production in India. Every year, more than 1,800 films are produced collectively in various languages in India. And India cinema is a global enterprise and outreach in more than 90 countries across the world, including Southeast Asia, Europe, North America, Asia, Middle East, Africa, and China. In terms of starting with India is the first country in the world to have implemented comprehensive tobacco-free film and TV rules going beyond Article 13 of WHO FCTC. After opposition from Bollywood and the Ministry of Information Broadcasting in 2006, the government relaxed this blanket ban to permit tobacco depiction in films with specific warnings to be shown on the screen at the time of tobacco use, which was being depicted. In 2008, a film producer filed a case challenging the revised rules in the Delhi High Court, following which in 2009, the High Court struck down the rules banning smoking scenes in films produced in India. However, the Supreme Court of India permanently stayed the High Court judgment, after which the government introduced stringent rules related to the depiction of tobacco imagery in all films and TV programs screened across India, which took effect in October 2012. And the salient features of this tobacco-free films and TV rules in India includes that all films containing tobacco imagery need a strong justification for any tobacco product display to the Central Board of Film Certification. There need to be a screen anti-tobacco health spots of minimum 30 seconds duration at the beginning and middle of the film and television programs which display tobacco use. Screen anti-tobacco health warnings as a prominent static message displayed at the bottom of the screen during display of tobacco product use. For example, the smoking causes cancer or smoking kills for smoking form of tobacco use. Tobacco causes cancer or tobacco kills for chewing and other forms of tobacco. Warning written in black font on a white background. There should not be no display of the brands of cigarettes or tobacco products in any forms of tobacco placements, close-up of tobacco products, tobacco product packages. Such scenes to be masked or blurred by the producer, distributor, or broadcaster while screening. Considering all this, the salient features of the rules in at HRIDAY, we have it's the first global trend analysis showing change in tobacco depiction. And this study used validated film coding methods to study tobacco depiction trends in Bollywood films released between 2006 and 17, compliance with the rules after 2012, and any changes in the number of tobacco depiction after the rules which were implemented. In this study, the top grossing Bollywood movies released in India between 2016-17 using the Brit California method to be compared with the other studies conducted in USA and India that was used. In terms of study design, the content coding of this top grossing movies were conducted with the trained health officials from HRIDAY, and the time period of movie, as mentioned in the previous slide, it is from 2006 and 2017. The selection of movie included the new top grossing movie Bollywood movies per year, and the film selection based on the box office collection data from the major cities in India. In total, 250 movies were coded. And in terms of the procedure, included the counting of number of tobacco incidents. It's the platform on the films on demand streaming content as well. The compliance with the tobacco-free movie rules. So the information what was collected as part of this study included the compliance with the tobacco-free movie rules, name of the production house, director, producer, distributor, and the rating, which was actors who were the main leading actors in the movie, the CBFC rating, which included 3 rating as a part of the India system, which includes youth-rated films, that is UA, which includes the parental guidance required for the children under the age of 12 years, and adult-rated. Then what are the perceived messages, location of tobacco use, anti-tobacco messages. In terms of films and the training of the officials who were involved in the as a part of the coding methods, they were trained using the validated coding protocols, different type of tobacco products use scenarios, verbal or non-verbal references of tobacco use, introduction to the tobacco free films rules in India and hands-on experience on coding using the media player and the Microsoft spreadsheets. In terms of results, like out of 240 films, it is interesting to note that after the implementation of these rules, there is a decline in A-rated films that has been steeper compared to the youth-rated films. And the percentage of youth-rated films with any tobacco incident also showed a general decline, that is from 76% in 2012 to about 44% in 2013. And the study reports a decline in tobacco incidents per film after the implementation of 2012 rules in India. As you see the slides, the figure, it shows there is a decline, like after 2012, there is a decline in the depiction of tobacco use. In terms of the U-rated and this U-rated, there is a decline in terms of the steep decline in the adult-rated films, as mentioned in the others in the earlier slide. In terms of the compliance with all the three indicators, static warning, there was a moderate compliance, which includes static warning when tobacco use is shown on screen, use of anti-tobacco health spots, and posting on audiovisual disclaimer. There are some other common violations, which included incorrect text used for the static warning. For example, cigarette smoking is injurious to health. Instead of smoking kills or smoking causes cancer, and incorrect fonts and the background of display of the static warning that was used during the display of tobacco use. In some instances, the font was so small that they were hardly visible. These are some of the glimpses and examples where we can show some of the violations which I've just mentioned. In terms of the main, like the key learnings and the key results, the post-implementation of tobacco-free films TV rules in India in 2012, there was an overall decrease in tobacco depiction. There's a decline rates of tobacco depiction that may be attributed to first, maybe the monitoring of the Ministry of Information Broadcasting enforcement of the rules by Ministry of Health and Family Welfare and the civil society efforts, evaluation of WHO and water strategy. Those are the studies which were conducted by the agencies. Then there is a compliance with the anti-tobacco health spot that has increased from 2016 and 17. There's an enforcement of static warnings and audiovisual disclaimer that needs to be strengthened a little more to control this tobacco advertising and promotion through films or through the on-screen media. There is an increase in the viewership on demand streaming and not aligned with rules in India. So that may be the little more need for strengthening the tobacco rules in the movies and the other media channels. In terms of the global replication, like from this study, there are some of the recommendations which may include that there is a successful policy intervention, so substantial, which results in substantial decline in the percentage of tobacco incidents and tobacco occurrences crossing Bollywood movies since the implementation of the rules 2012. And India proves to be a global leader, maybe in terms of reducing the tobacco use exposure with effective implementation of Section 5 of COTPA and Article 13 of FCTC. There is an opportunity or scope for the stringent tobacco free films rules that are successful in curbing tobacco use exposure and should be recommended as a best practice for the global replication, extending these rules to streaming platform, which is very, very needed at this point of time. To assess the impact, and the future research priorities may include to assess the impact of this reduced exposure on tobacco use among adolescents and youth. Thank you, Neha. So over to you. I think we are already running a little late. So over to you. Thank you so much.
Thank you, Tina. And this was indeed a very interesting presentation, and no doubt it was a very interesting methodology that was used by you and your team in this study. Especially, I'm very amazed to see how important role a policy can really play, and I'd really like to reiterate how a good policy and a strong policy can really help to take the agenda of tobacco control. I'll now move on to introduce our next speaker. Our next speaker is Dr. Marcia Zorrilla. who's a public health specialist and the director of positive youth development of the Halpern-Felcher Stanford Reach Lab in the Division of Adolescent Medicine, Department of Pediatrics at the Stanford University School of Medicine. She's bilingual and has 25 years of clinical experience working in adolescent health, youth development, and school-based healthcare fields. Welcome, Dr. Marcia, and I'll hand over the mic to you for your presentation.
Thank you very much. Hi, everybody. So glad to be here. So today I'm going to be speaking with you about the strategies that we've used with the YAB to raise awareness among their peers when it comes to tobacco. Next slide, please. So I want to give a shout out to the YAB, especially Aditya and Abhinav. They're both here. They're part of the YAB. And the YAB was established in January of 2020, so 3 months before the pandemic. And we were meeting in person, but then since the pandemic, we've been meeting via Zoom. So we have 28 youth that are part of the YAB. So the majority are from California. We have youth from North Carolina, New York, Maryland, Michigan, Texas, and India. About 70% or so are high school students. We have a mix of young men and young women, and 98% of our youth are youth of color. Next slide, please. So my question to you, and you could put this in the chat, is where are youth seeking information? So what are they using to obtain information? You could just add that in the chat. Yeah, so thank you for that. Social media platforms, absolutely. So not only are youth seeking information, but they're also trying to find ways to connect with other young people and other communities. So next slide, please. So I'm going to show you what the YAB created. And so this was created during the pandemic as a way to do peer-to-peer health education. And it's on tobacco prevention, cannabis prevention, mental health, and wellness. So I'm going to explain this feature that's called Trivia Thursday. So every Thursday, there is a trivia day. And so this is an example of one of the questions that we're going to play. So the trivia question that you see here is, which of the following is false about pod-based e-cigarette vapes, like Juuls or bars, that contain nicotine? So A, they create an aerosol, not a water vapor. B, they contain nicotine. C, they feel less harsh in the throat compared to cigarettes, making it easy for young people to use. Or D, each pod has less nicotine than a pack of cigarettes. So type it in. What do you think it is? Is it A, B, C, or D? So remember, which one is false? What do you think it is? So no worries, A, B, C, or D. D, okay. I see a couple of Ds. Great. Okay, so what we would do would be swipe. And so when we swipe to the next slide, we get the answer. And the answer is D, so good job. So what this is telling us here is that it's false because one single pod has about double the amount of nicotine. So you see the comparison of the different products. So this is definitely one way that the Youth Action Board uses social media, using Instagram. So give us a follow, and if you have youth that you work with, have them follow the YAB as well. Next slide, please. So where do we go with this? So how do we raise awareness? So we've already heard in earlier presentations today, education is really the key. So it's really the key to mobilize young people. So some examples, just from even this particular slide, is doing peer-to-peer health education. Other ways are writing letters to the editor, or perhaps using a podcast to educate people about menthol and its impact on the Black community. It could be about using art in theater pieces or poetry slams. We actually have a YAB that is a poet, and it's great. So really, what are some of the ways that young people are communicating and expressing their feelings? In closing, in California, there's a state ballot which would ban the sale of flavored tobacco products. So many in the YAB are going to be 18 or they're close to being or already 18, and so they're eligible to vote. So mobilizing youth to register to vote is another way to mobilize youth into action. And that is my very quick introduction to the YAB and using Instagram. Thank you.
Thank you, Dr. Marcia, for very insightful presentation and how social media is being used